I'm about to reveal something that might shock you. Something that could be sitting in your bathroom cabinet right now, silently attacking the most important organ in your body. I'm Dr. Michael Kent, and after 2 decades as a cardiac surgeon, I've watched perfectly healthy people walk into my operating room with hearts damaged not by disease, but by medications they trusted completely. These aren't exotic drugs or experimental treatments. I'm talking about the pain reliever you took this morning, the stomach pill you swallowed with breakfast, even the cold medicine you grabbed last week without a second thought. What I'm about to share goes against everything you've been told about these so-called safe medications. The pharmaceutical companies don't want you to know this. Most doctors won't tell you because they simply don't realize the devastating connection. But I've seen it with my own eyes, patient after patient, heart after heart. And I refuse to stay silent any longer. By the end of this video, you'll understand exactly which 5 medications are secretly weakening your heart muscle, why they're so dangerous after age 60, and, most importantly, what you can do starting today to protect yourself. This isn't fear-mongering. This is life-saving truth. Stay with me because what you're about to learn could literally add years to your life. Let's start with the medications found in virtually every home in America. The nonsteroidal anti-inflammatory drugs, or NSAIDs for short. You know them by names like ibuprofen, naproxen, and diclofenac. They're your go-to solution for headaches, back pain, arthritis, discomfort. They work brilliantly. There's no denying that. But here's what nobody tells you. Taking these pills regularly after age 60, especially if you have any heart concerns, is like playing Russian roulette with your cardiovascular system. The medical community has known about this dark secret for decades. Back in 2005, the FDA demanded clear warnings about heart attack and stroke risks on these medications. Yet, millions of people still pop them daily like candy, completely unaware of the danger lurking inside each tablet. Let me tell you about Michael, a 72-year-old patient who loved working in his garden. He suffered from knee arthritis and took almost every single day to manage the pain. One afternoon, while tending to his rose bushes, he felt completely drained. He couldn't catch his breath and his ankles had swollen to twice their normal size. When he arrived at the emergency room, we discovered he was experiencing acute heart failure. His heart, already working overtime due to his age and mild hypertension, simply couldn't keep up anymore. The trigger wasn't a new cardiac condition. It was the continuous use of that innocent-looking anti-inflammatory pill. How can something so common be so deadly? The mechanism is insidious. NSAIDs block certain enzymes to reduce inflammation, but in doing so, they also interfere with substances that protect your kidneys and blood vessels. This creates 2 catastrophic effects. First, they force your body to retain salt and water. Picture your heart as a pump. If suddenly there's much more fluid in the pipes, that pump has to work at maximum capacity. A young heart can handle this stress, but a heart that's already dealing with age-related stiffness or fighting high blood pressure can fail completely, just like Marcus did. Second, NSAIDs can constrict your blood vessels and elevate blood pressure. Even if you don't have hypertension, regular use can raise it significantly. And if you're already taking blood pressure medication, NSAIDs can completely cancel out their effect, sending your pressure skyrocketing without you even realizing it. It's critical to understand that the risk depends on dose and duration. Drugs like diclofenac and high-dose ibuprofen, around 2,400 milligrams daily, are the most strongly associated with cardiac problems. Low-dose naproxen appears somewhat safer, but the risk is never zero. And here's another shock. If you take low-dose aspirin to protect his heart, certain NSAIDs like ibuprofen can actually neutralize that protective effect entirely. So what should you do? The solution isn't to suffer through pain. It's to have an honest conversation with your physician. Ask directly, "Doctor, given my medical history, what's the safest pain relief option for me?" Alternatives exist. Sometimes acetaminophen is sufficient. Other times, topical anti-inflammatory creams or gels that work locally are excellent choices. And if an NSA is absolutely necessary, the golden rule is lowest dose for the shortest time possible. Now, we arrive at number 4. And this one will absolutely surprise you because it's marketed as a stomach protector. I'm talking about proton pump inhibitors, or PPIs, omeprazole, pantoprazole, lansoprazole. These are among the most prescribed medications in the entire world. Millions of people take them every morning, almost like a ritual for reflux or to protect their stomach from other medications like the NSAIDs we just discussed. And here's the bitter irony. The medication prescribed to protect you from one risk might be creating another danger through the back door. Let me share the story of Helen, age 68, who was prescribed omeprazole for chronic reflux. She was told to take it for life. Her acid reflux disappeared, and she never questioned it again. Years later, during a routine checkup, her electrocardiogram showed something unusual. Blood work revealed the cause. Her magnesium levels had plummeted dangerously low. Magnesium is the guardian of your heart's rhythm. When it's depleted, your heart becomes electrically unstable, like an orchestra without a conductor, and dangerous arrhythmias can emerge. The cause of Helen's deficiency: chronic omeprazole use. PPIs reduce stomach acid, but that acidity is absolutely crucial for absorbing nutrients. When you suppress it long-term, magnesium absorption collapses. But it doesn't stop there. There's something that concerns us even more. Multiple observational studies have found an association between PPI use and increased heart attack risk. One theory suggests these drugs might reduce nitric oxide levels, a molecule that keeps your blood vessels flexible. When it's depleted, vessels harden, setting the stage for a heart attack. The causal relationship is still debated, but the association is deeply concerning. Additionally, omeprazole can interfere with vital medications like clopidogrel, an antiplatelet drug given after heart attacks. It can make this protective medication less effective, leaving the patient vulnerable. The problem is that these drugs have become trivialized. They were created for short-term treatments of 4 to 8 weeks, but they've become a permanent solution for problems that could often be managed with lifestyle changes. If you've been taking a PPI for months or years, don't stop abruptly. Talk to your doctor. Ask, do I really need this long-term? Can we reduce the dose? Are there alternatives? And if you must take it chronically, it's essential that your physician monitors your magnesium levels periodically. Before we continue with the next medications, which include some for simple colds, I want to make a quick request. If what you've heard so far seems valuable, I'm asking for 2 simple things. First, subscribe to this channel. My mission is to provide clear, straight-shooting health information so you can make the best decisions. Second, and perhaps more important, share this video. Think about your parents, your grandparents, your friends. A simple click can start a conversation that could genuinely save a life. Thank you for your support. Let's continue with number 3, one that almost everyone has at home. We've reached number 3, oral decongestants for colds and flu. The ones containing pseudoephedrine or phenylphrin. They're the magic solution for that stuffy nose that won't leave you alone. But that magic solution can carry an extremely high cost for your heart, especially if you already have high blood pressure or any cardiovascular disease. Margaret, a 75-year-old retired teacher, caught a severe cold. To breathe easier, she bought a well-known cold remedy with pseudoephedrine from the pharmacy. By the second day, she felt like her heart was going to burst out of her chest, along with terrible dizziness and a splitting headache. Her son rushed her to the hospital. Her blood pressure was through the roof, and she had developed an arrhythmia. That decongestant had pushed her to the brink. Why does this happen? Pseudoephedrine and phenylphrin are vasoconstrictors. Their job is to narrow blood vessels in your nose. That's great because it reduces swelling and you can breathe. But the drug doesn't act only in your nose. It travels throughout your Entire body constricting blood vessels everywhere. This has two consequences. First, by narrowing the arteries, your heart must pump against much greater resistance. It's like trying to push water through a squeezed hose. The pressure explodes. This can trigger a dangerously high blood pressure spike. Second, they're stimulants. They make your heart beat faster and irregularly. If you already have a sensitive heart, this extra stimulation can destabilize it completely. Recently, European agencies have refocused attention on pseudoedrin due to its link with rare but serious syndromes involving constriction of blood vessels in the brain. This only demonstrates how powerful its effect is throughout the entire body. The major danger with these drugs is that they're available over the counter. People buy them without reading the fine print and without thinking about the risks. If you're over 60, and especially if you suffer from hypertension or any heart condition, avoid them completely. There are much safer alternatives. Saline nasal sprays, humidifiers, or nasal sprays with corticosteroids that act only locally. Don't let relief for your nose become an emergency for your heart. We arrive at number 2, a delicate but vital topic, mental health. I'm talking about an older class of antidepressants that are still used sometimes for depression and other times for chronic pain. Tricyclic antidepressants, names like amitriptyline or imipramine. Depression itself is a risk factor for heart disease. That's why treating it is crucial. But how we treat it matters enormously, and these drugs can be dangerous for an older person's heart. Frank, a 78, suffered terrible pain in his feet from diabetes. His doctor prescribed a low dose of amitriptyline. It helped with the pain, but he started getting dizzy every time he stood up. One day he fainted and fractured his hip. The cause was the amitriptyline, which triggered a sudden drop in blood pressure when standing, called orthostatic hypotension. But that's not the only risk. These drugs can also accelerate resting heart rate, which means constant stress for an aging heart. And what's most concerning, they can interfere with the heart's electrical system, slowing down impulses. This shows up on electrocardiograms and increases the risk of very dangerous ventricular arrhythmias that can cause sudden death. For all these reasons, tricyclic are no longer the first choice for treating depression in older adults. Today, we prefer newer antidepressants that are safer for the heart. However, they're still prescribed for neuropathic pain. If you or a loved one takes one of these medications, it's fundamental to talk with your doctor. Have safer alternatives been tried? Is blood pressure and heart rhythm being monitored? Mental and physical health go hand in. You need to ensure that treatment for one isn't damaging the other. And we arrive at number 1. This is perhaps the most controversial and debated point, but it's my duty to share the concern that exists in the scientific community. I'm talking about calcium supplements. Yes, you heard correctly. Those pills that millions of people take every day to protect their bones from osteoporosis. For decades, the message was crystal clear. Take calcium for strong bones. But in recent years, more and more studies are questioning the safety of these supplements for the heart. Let me tell you about Linda. Age 70. Worried about osteoporosis, she started taking a high-dose calcium supplement on her own. Years later, she suffered a heart attack. She didn't have the classic risk factors. She didn't smoke. Her cholesterol and blood pressure were fine. Investigating possible causes, her medical team focused on that daily supplement. The controversy is real, and the evidence isn't definitive, but the hypothesis concerns us deeply. Calcium obtained from food sources like dairy or vegetables doesn't seem to be a problem. It's absorbed slowly, and the body uses it efficiently. The problem appears to arise with the high concentrated doses from supplements. When you take a pill, it creates an artificial spike of calcium in your blood. Your body can't use all that calcium for your bones, and the excess has to go somewhere. The primary concern is that it deposits in artery walls. This process, arterial calcification, makes arteries rigid, and can contribute to forming the plaques that cause heart attacks. Some large studies suggest calcium supplements modestly increase heart attack risk, while other studies haven't found this connection. The evidence is complex, and for people with diagnosed osteoporosis, the benefits might outweigh the risks. But the lesson is clear. More is not better. The safest strategy is getting calcium from your diet. If your doctor believes you need a supplement, never start taking it on your own. It's a medical decision that must weigh your bone health and very importantly, your cardiovascular risk. Today, we've uncovered the hidden side of 5 very common types of medications: anti-inflammatories, gastric protectors, decongestants, certain antidepressants, and calcium supplements. My main message isn't panic. It's not stop taking your medications. Doing that on your own would be extremely dangerous. My message is empowerment. Now, you have valuable information that most people ignore. You know that the pill for arthritis can overload your heart. You know that your stomach protector might be affecting your heart rhythm. You know that a simple cold remedy can be a serious risk. Use this knowledge to become an active partner in your own health. The next time you see your doctor, go prepared. Take a list of everything you're taking, including supplements and vitamins, and ask clear questions. Doctor, I've read this medication could have risks for my heart. Is it still the best option for me? Are there safer alternatives? Should we monitor something like blood pressure or run specific tests? Every treatment is a balance between benefits and risks, and that balance changes with age. Your heart has worked hard for decades. It deserves exquisite care. Protecting it is the best investment you can make in your future. Don't take any medication for granted, no matter how common it seems. And now, I'm asking one last thing from you. Share your experience in the comments. Did something here surprise you? Your stories can help others. And remember, always talk to your doctor. That conversation is the most important step you can take today to protect your heart for tomorrow. Take care of yourself.